run class over, and we have still a few slides to cover. At this point, we want to look at the heroes, the medical heroes. This has to be my favorite. This is Suzy King Taylor. She had a very interesting background. And for my colleagues out there, anytime you hear me whining or complaining, just say Suzy King Taylor. For the fact that she was born into slavery, and at the age of 7, her owner said, yes, you can go live with your grandmother who was in Savannah. You have to understand that at that time, it was against the law for slaves to have any type of education. And so her grandmother sent Suzy to secret schools. There was 2 African American women that were doing this. And it was really interesting because the girls had to go at different times. They could never go together, and they had to cover their books with paper so people could not, know that they were going to school. Well, then she went on and moved to St. Simon's. A lot of the individuals moved there, and she actually started a Freeman School. That's basically of any of the freed slaves, teaching them how to read and write. And again, the first to teach former slaves in Georgia. And at the St. Simon's Island, she met her husband, and so she also served as a nurse to the troops. And you can see right there. So she really is my favorite. To think that you came through that and yet served. And she did not get paid for her service as a nurse ever. It was never recognized, but always volunteering. And I'm not really that much into quotes, but this one really struck me. It seems strange how our aversion to seeing suffering is overcome in war. How we are able to see the most sickening sights, such as men with their limbs blown off, mangled by deadly shells, just as what we heard about, without a shudder. And instead of turning away, how we would hurry to assist to alleviating their pain with feelings of only sympathy and pity. A true spirit. This one individual is certainly more famous than Suzy. This is Clara Barton. She's quite well known. And as you can see, she did a variety of service. At the beginning, she was a teacher. Then she volunteered to take care of wounded soldiers. A lot of different things. When you're taking care of these groups, you deliver supplies, first aid, carried water. I mean, you did it all, not just caring as a nurse. And she worked in the field and was recognized basically for her organizational skills. And just to travel through her career, she went to Geneva. It was the International Red Cross, and then in 1880, established the Red Cross, the American Red Cross, and she served as the first president. So when you hear about Clara Barton, that's what she's well known for. This is the kicker. This is what really struck me about Clara. Look at that age. At the age of 83, she resigned as president. But what did she do? She didn't kick back. She went on to found the National First Aid Association of America, and it was basically supplying instruction about first aid, emergency preparedness, and also the development of the kits that could go out. So, our hats go off to her for sure. This was Dr. Letterman. You may have known the Letterman Hospital in California, in California. Well, it's named after him. But he really was recognized as the battlefield medicine, the father of all that. And just to take him back in history, he graduated from med school. He was the assistant surgeon, but then also served in military campaigns as well. So not just as a surgeon, but also in a lot of different campaigns. Well, if we follow him, he came on duty in July, and what he found is a lot of men that were sick as well as wounded. This is where my nutrition background helped a little vitamin C deficiency. That vitamin is found in fruits and vegetables. And if you do not have, it's a water-soluble vitamin, and you need it every day. The body doesn't store it. Well, if you don't have it, basically your teeth fall out, and you get blemishes under skin. In other words, this vitamin helps hold your body together. And so what he saw was basically a vitamin C deficiency. And right away, what did he order? Basically vegetables. How did that turn? I didn't bring it back. I'm not sure why they did the fresh bread though, because fresh bread has no vitamin C. But maybe just as a, helpful filler in. But it was immediate result. And so my hat's off to him for knowing his nutrition. Probably the one thing that he's most famous for is this, is basically getting all of those men into good care. And so he came up with what they called the endless cores. And what you see here are the cores. This is the first time that any wagon or device was designated just for the wounded. It wasn't for supplies. It couldn't be used for supplies. It couldn't be used for ammunition. Only the wounded. Take the next one. Now, again, you're trying to get this off the battlefield and try to get it into good care. What he came up with was a system, for the most part. He would have first aid stations, and then he'd have mobile field hospitals, and then a very efficient distribution of the supplies. And so a real organizational mind to get supplies to the men. Now, again, you can see, for the most part, these are the different wagons. And so they're pulling them in and taking them forward. This is the specifics. I went into and found a little bit more information. So we had first responders. Well, we have first responders now, basically getting to the firing lines. And then they would get, this is the real interesting. He had mapped out, he knew the battles. He would predetermine the evacuation route. And so he planned it all out before even the battle happened. And so I thought that was real vision, to get the men taken care of. They also had dressers. And what that was is triage. Instead of just taking everybody, in order as they came in, it was basically the most serious, immediate, and last. And so it was a triage, pretty much the ones that hurt the most got the priority. And then obviously then it went to long-term recovery hospitals. And here is just a shot of him with President Lincoln. And again, more shots here of basically the vehicles that would carry the wounded. And then this was his camp at Gettysburg. Again, very organized. And that's another shot of it. And here's basically the hospital that is named after him, and that's in San Francisco. The father of modern emergency medicine, and you can understand that. This is the sad part about his life. There was a little, basically, conflicting agreements toward the end of the war, and so he left. But he did marry. This was in California. But look at this short time. She suddenly died. And he went into a very deep depression, and for the most part became very chronically ill. It was a GI problem, gastrointestinal problem, and then he died at a very young age, 47 years. But before he died, he left us with wonderful records. And that was one thing that I really saw, is that the doctors, they really write. You can really understand very complete records of all the ongoings with the medical aspect. Now this is Lisa Elcott, and obviously she's known for Little Women, but for us, what we're interested in is the Civil War hospital sketches. I really like to read, but boy, was this a hard one. It was really hard to get through because of the vividness of what she was going through and what the soldiers were going through. It wasn't I think it was more of a heartbreaker than anything else. Not a tearjerker, but a heartbreaker, just to read through her writings. And so we certainly attribute that to her related to the Civil War. This was a great family. The Woolsleys, basically the mother and father, they had several daughters, and well-educated, very strong political and abolitionist and unionist views, but then the father died, and so the mother basically raised all those children by herself. But it was really interesting, all of them, and this is only 4 of them, they had cousins, and they also had another sister, all involved in delivering supplies, transporting soldiers, care of the wounded. They became hospital superintendents, very much involved with taking care, as well as instructors and writers. And here is hospital days, and then you can see as well as there. And this was Jane. She's that one right there. Now, Dorothea Dix was really interesting. Really hard beginning for this individual. And again, we give respect to these individuals to grow through that. And the fact that 15 years old, she started a school for girls. Her entire life was really to improve the lives of the less fortunate. That was her main vision for her life. And this is a book, Breaking the Chains, and you can sort of get a feel of why that title would be very effective for her. But we certainly want to recognize her. This was the one about, for the most part, that she saw that poor people with mental illness were confined in cages, closets, cellars, stalls, pens, chained, naked, beaten with rods. That, when she saw that, that just drove her to be a mental health reformer. In the meantime, again, the Civil War very much involved improving the lives of the less fortunate. This was really interesting. This was probably the controversy that she had. She wanted all the nurses to be over 30 and plain looking, so there wouldn't be any, that extra going on, and they would have to wear dull attire. Well, she couldn't get enough of the nurses, so it was basically got down to anyone willing to work. But check out the wage, 40 cents a day, plus rations, housing, transportation. The male nurses, they got more superior benefits. Some things haven't changed, some things have. Now, there's many, many more women that we can't talk about tonight. I wish we could. It would take a whole series just talking about all of the women that have been reported that helped. All of these, and I do have these books. And again, those stories are so heart-wrenching to understand that they really took care of these individuals. So that brings us to revolutionary. Now, in your mind, you probably think, oh man, this is revolutionary? Well, I wanted to stay with the R thing, the 3 R's. Kind of get it? Well, the revolutionary, in my mind, meant the meaning is bringing about a fundamental change. And so what we're now going to be talking about is medical advancements that came from the Civil War. And this is my researcher going back. I went to the literature to find this for the most part. This is Blaisdell's basically accounting of the medical advancements. And so we will start on this side. For the most part, again, this is coming from Letterman, that they had Billings-style general hospitals, well ventilated, clean. They had definitive treatments of the wounds. They had a protocol. They had a practice of care. And I had mentioned earlier the accumulation of the detailed reports by these surgeons, well written, you could really understand. And that started a whole process that continues today. And this is what we saw with Dr. Letterman, aid stations, field hospital, general hospital. There was more. With amputation, they found that optimal recovery would be in that first 24 hours. And that makes sense, doesn't it? It makes sense to us. but they didn't make sense to them then. But here we go with the importance of sanitation. Also, the female nurses were introduced to hospital care. In Jane's book, it was really interesting. It was noted in Georgiana that Georgiana, one of those sisters, she said the doctors didn't want them there. They did not want those nurses there. It was the government that said yes. President Lincoln said no, those women are going to be there. The doctors didn't want them there, and so they treated them not with well regard. And so again, those women, they stayed there and took care of the soldiers. And then also the wrong one. And also then the training of physicians, how that came about, and the Sanitary Commission, and then later the American Red Cross. Now we're going to go into basically transportation or transport and amputation. So let's show the video first, and this is from the Civil War.
Life within a Confederate hospital was a harrowing experience for most patients. Thousands of soldiers suffered from a variety of disfiguring injuries, many of which made it difficult or impossible to lead an otherwise normal life. Their first introduction to hospital life began when they were carried from the field on stretchers and taken to small forward aid stations. There, assistant surgeons provided first aid to the wounded and routed cases onto field hospitals, which were temporary hospitals set up in tents or buildings behind the lines. The primary function of the field hospital was to receive wounded from the field, stabilize their condition, perform necessary amputations, and then evacuate them to general hospitals where they were treated and, if they didn't die, either discharged or returned to the Army. The majority of soldiers arriving at field hospitals had wounds to their extremities. When bone damage was severe, amputation was the prescribed method of preventing a life-threatening infection, gangrene, or death.
75% of the wounds that soldiers received were to their extremities, either to their arms or to their legs. And 76% of the wounds were caused by the mini ball, this conical-shaped bullet of soft lead. And what tended to happen is when the mini ball struck, if it struck bone, it didn't just fracture the bone as a musket ball might have done. It shattered the bone. It drove bone fragments into the surrounding area. And in addition to this, because this bullet is of soft lead, it would mushroom out and form a much larger hole. They did need a second assistant to stabilize the limb that was going to be amputated. So there would be an assistant to hold onto this leg, make sure that it was at the correct angle so that when the surgeon does the cutting, that saw doesn't get into a bind. There was a third assistant who would be in charge of the brass screw tourniquet. This is going to keep our patient from bleeding to death while he's on the operating table. A lot of people know that they didn't sterilize the instruments. Another problem that was equally as bad is that often the instruments were not as sharp as they were supposed to be. So instead of getting a nice clean incision, it was often more of a ripping and tearing that went on. But the Catlin knife was used simply to cut through the skin. And let's say that our patient was wounded here. We're going to move up slightly above that wound and make an incision in the skin. And then that skin would be peeled back. The surgeon would then take a scalpel and use the scalpel to cut through the next layer of flesh, the muscles and tendons. And that incision would be made slightly further up the leg. And again, the cut would be made all the way around, and then that flesh is going to be peeled back. Now we're ready for the capital bone saw. And that is what was used to sever that limb. And the assistant here, who was stabilizing this leg, take that leg, throw it into a pile with all the other arms and legs that had been cut off that day. After the leg has been severed, after that bone has been cut, the surgeon would take this device, a tenaculum, and use this to grab a hold of arteries and blood vessels. They're elastic. They tend to retract and go back into the body. Tenaculum was used to hook those vessels, pull them out, and then the surgeon would ligate them or tie them off using either silk thread or horsehair. After the arteries were ligated, the surgeon would then make sure that the end of that bone was smooth. There may be some shards left behind. So the surgeon would take these gnawing forceps or bone nippers and just nip off any jagged pieces of bone. Then he might take a bone file and smooth off the end of that bone so that it's nice and smooth. When the surgeon cut, he cut skin, then he cut muscle, then he cut bone. So what you end up with is a flap of muscle and skin that hangs down beyond the bone, and that forms the stump. That would be a cushion against the end of that bone.